We're speaking to Kwabena Mintah, Akandoh, Health Minister, trying to understand the agitations from the health sector. He held a press conference a couple of days ago announcing that a number of health professionals who had not been put on payroll will be put on payroll from November. The minority says he didn't need to have gone to say anything about cabinet. This is something they should have just done. I wanted you to show me a couple of things. You said when you took over, there were 13,500 nurses
recruited
who had been recruited.
Yes, and no financial provision was made.
And that you started?
And then let me make this point. You know, if health professionals are recruited and you are given the budget, the compensation, you don't need to go to Parliament or Cabinet or even a finance ministry. But if you don't have it as a ministry, Ministry of Health, you always have to collaborate with the Ministry of Finance, and if it's above the Ministry of Finance, you go to Cabinet.
Okay.
So the money doesn't sit with the ministry. If it sits with the ministry, you don't need to go.
So because allocation had not been made, you had to go and argue in cabinet.
Argue in cabinet for the allocation.
You said you had money to pay 7,000 or so.
Yes.
Do you have the breakdown of that whole situation? You said
yes.
13,000 recruited.
Yes.
And they were not being paid, and you managed to pay about half of them.
Yes. So we have how many were captured on the payroll.
Do you have that information here?
Yes, I have it.
Yeah. Where is it? Is it this one?
Yes, this one. Yeah.
Can you explain what this is?
Yes. So if you check the table, total clearance issued. They issued clearance to recruit about 15,200.
This is before they left power?
Before they left
MPP.
Power.
Okay.
And then they actually recruited 13,500. Okay. Now, out of the 13,000, when we realized that this is what we have, we either have to let them go home or... So we captured about 10,315 on the payroll, Controller Accountant General.
When?
That was around after March. You understand? And so on that same figure, the number 10,000 that has been captured, about 7,239 are being paid.
From which period? From March?
From March, thereabout. Then you see the figure is 10,000, that is on the payroll. So there's about 3,076 that are on the payroll, but they are not being paid. If you check the figure, 13,500, 10,000 on the, so there's another figure that has not been captured at all, 3,000.
So you can say about 6,000
exactly.
were not being paid.
At all.
Some not captured, some captured.
Exactly. So this is what we currently...
When you say captured by controller, what does it mean?
If I don't know how you want to just say.
No, so if
a controller...
I want to understand. It means, is it that controller doesn't think they are nurses and therefore he won't pay them, or he has not finished the process of putting them
No,
in
you see,
system?
before you even initiate any payment from controller, it must go through a process. Okay? So we went through a process, but then even if they are on the payroll at the controller, you need certain documentations like the financial clearance and then hologram. So if the finance ministry doesn't issue the financial clearance and the hologram, although they could be on the controller's list, but they can even cease payment.
I see.
Do you understand it now? And so there were about 3,185 which were not on the payroll at all.
Have you, based on your announcement yesterday, put these people on the payroll now?
So a letter has been issued from the Ministry of Finance that they'll begin to pay them from November.
So it means that by November, all these 13,500
exactly
people will be paid.
Will be paid.
Good.
So it is not, let's make the point, it is not as though they made financial provision, they were on the payroll, they were being paid, and we stopped it.
Fair enough. Somebody said government is a continuum.
I agree.
So you came to power to solve
no
problems.
lamentation, solution. I agree. But you see, when the very person...
So by the way, the November they will be paid. Had they been working from January?
Yes, they've been working for...
So even though they were not captured or their clearance had expired, they were still working?
Yes, so there will be...
So are you paying them their backlog?
Yes, so there will be a schedule for...
Or back pay, as they call it?
Yes, there will be some arrangement for the payment of the backlog. But then from November, all the 13,000 will be paid. Then government will...
Because you know that they can also I've seen before people complain about their back pay not being paid.
Yeah, we will pay.
So from November, you are paying them November salary.
We'll have an arrangement. From November, we'll pay the November salary, and then we'll tell them, we'll communicate how we are going to stagger the payment.
Deputy Minister for Finance said that 74,000 health professionals are waiting to be employed by government. Yeah. And you say it's correct. Do you have a breakdown
Yes,
of that?
I have the breakdown. And we will need not less than 6 billion
6 billion
Ghana cedis to be able to absorb all the 74,000 health professionals at home at the moment.
Are you serious?
So
explain this to me.
So this is what we inherited. Medical doctors, the 2024 batch, who had finished their housemanship and they're at home, were around 942.
So 2024 batch, 942 medical doctors.
Very good.
They had finished housemanship, ready to be full doctors.
Doctors to go to the various hospitals.
942.
By the grace of God, we've been able to, recruit them. We've had clearance for them, and now, very soon, they are going to start work. So this has been sorted. Now, allied health professionals, the last time they did recruitment for allied health professionals were somewhere in 2018. So from 2019 to 2024, we have about 19,000 backlog at home.
Are you saying they had not employed any of them?
Them.
These were the ones who could not get employed?
No, they had not. They had not employed any of them.
Are you serious?
Yes.
19,000 allied health professionals?
Yes.
Who is an allied health professional? Like what? Lab technicians?
Exactly.
Those kind of people?
Exactly.
19,000?
Yes. So we have pharmacy doctors. About from 2019 to 2024, we have about 800 of them at home.
Wow.
We have pharmacy professionals, about 500 at home, nurses and midwives. So if you go to the nurses and midwives, the 2021 batch, they are at home. They are about 15,000.
2021, those who were ready to work 2021?
Yes. And then 2022, they are about 17,000.
All sitting at home?
Sitting at home. 2023, they are about 15,000. Physician assistant, they are about 3,000. So if you add everything, you are getting about 74,000. And Bernard, the danger is that at the end of 2026, another 23,000 will come and add. Hear me well. So we'll hit about 97,000. By the end of 2027, another 35,000 will come and add.
You are looking at those who are in school now?
Who are in school now. By the end of 2028, another 47,000 will come and add.
And this is all of these people together?
Exactly. If we leave this figure without doing anything about it, in the next 3 to 4 years, by the end of 2028, we'll have not less than 180,000 health professionals trained and they're at home.
Is there space for them? Is there work for them to do?
Yeah. You see, the truth of the matter is that you can only absorb what your budget can contain. It does not necessarily mean that there are no work in there. You go to some health facilities, we still need them.
So we need these guys, but we don't have money to pay them.
You cannot, absorb all of them. For example, we need 6 billion Ghana cedis for the health sector alone to be able to absorb the 74,000. So there should be a strategy. And I just want all of us to understand what we have come to meet and what will be coming. So that when we are solving the problem, everybody...
Sorry, can you go to... You are saying that from next year, how many more are joining?
So from next year, that is by the end of 2027, by the end of 2026, we have additional 23,000.
Wow.
By the end of 2027, we have additional 35,000.
Wow.
By the end of 2028, we have about 47,000. So by the end of 2028, if we don't employ anybody, and this 74,000 is still outstanding, we will have not less than 180,000 health professionals trained and they will be at home.
So when will you employ these 74,000?
Okay, so there's a strategy going forward. What we are seeking to do now is that, of course, gradually, government will be employing some of them as we move along. We are also looking at what we call managed migration, how we'll be able to export some of them. It's another strategy.
You are going to export them?
Yes, that's what we are thinking about. Now, about 13 countries have responded. But the difficulty is that most of these countries that have responded, they need a specialist. You understand? And we don't have many of the specialists in the system. So the ministry is collaborating with University of Cape Coast, trying to get a curricula to be able to train more of the specialists. So instead of, let's say, 2 years, without compromising on quality,
wow,
we want to have a crash program to be able to train more within 1 year so that they will meet the global standard and we can be able to export some of them whilst we maintain the optimal workforce we need as a country. Because even if we decide to fill all our health facilities with this optimal workforce, we'll still have some health professionals still at home.
So you are expecting about 180,000 health professionals by end of Mohammed's first term.
Yeah.
MPP began something called Agenda 111, which is essentially to build 111 hospitals. It appears as though this government is not interested in it.
We are very much interested, but what I can say for now is that we are auditing the whole process.
You're auditing what?
We are auditing the whole, from the civil works to the finances, how much has been paid, who has been paid what, work done. Then we understand what we have inherited and see the strategy we would apply.
How many of them were built before you took over?
Well, as at the time we took over, there were about 3 of them that were more than 80, 90% complete. They were the ones that said they were in operation, but when we visited the site, they were not actually in operation.
As we speak, are any of the Agenda 111 hospitals in operation?
Not a single one of them.
You are sure?
Yes. They didn't.
So, but what was the highest percentage of completion?
That was around 80%, but I think the full report will come at the end of the audit. I don't want to preempt the audit.
Was any budgetary allocation made for Agenda 111 hospital in the ATU's first budget in March? Why not?
Because you have to understand what you are inheriting before you can budget for it.
They said they are building hospitals and they started the hospitals.
There is no dedicated source of funding. And so they were only relying on GOG. And so if you want to go that route, you must understand what you have inherited. And
so when you get the full audit, what will you do with it?
So when we get a full audit, there's a strategy. What we're going to do is that those that are far advanced, government may want to continue. But
where far advanced means what?
Above 70% completion. And then those below 70% will bring the private sector in PPP.
Don't forget, NDPC told us that project delays cost overruns.
We will not delay them. Once the audit report is ready.
So what if a hospital in Joaboso is 20% complete? Will you abandon it?
No, we won't abandon any of them. What we are saying is that we'll bring, for example, churches that are interested in running hospitals. CHAG, with government partners with those institutions. We give them personnel and they run these health facilities. So we'll reach out to them, individuals, people who are interested.
So you're saying those who are above 70%, you use government of Ghana money to finish?
To continue.
And those below 70%, you will find a private sector partner?
Yes.
So if you don't find a private sector partner, what will you do?
We'll find.
From where?
We'll find in the country.
Has any private sector person
It doesn't also necessarily. It doesn't also.
Have you done any work to show that?
Yeah. A lot of them have even approached us, especially the churches. The Pentecost leadership have approached us. The CHAG.
But would this be district hospitals? Because the understanding I had was some of them are district hospitals.
Yeah.
Can district hospital be run by a religious organization?
Oh, some of them are doing far better. They already have some hospitals that are at the level of district hospitals.
Okay, there are some hospitals which have not finished. Outside Agenda 111, La General Hospital is always in the news.
Yeah.
What is happening to that hospital?
Yeah, so La General Hospital, in the 2025 budget, we've made an allocation for La General Hospital. So we've made allocation of not less than 130 million Ghana cedis for La General Hospital, and it's being processed for payment.
So when will work start?
I am very, very sure. Even as at the time I visited, they were still on site. So I know that very serious work will start maybe next week.
Okay, let's deal with a few other issues. NHIA is a perennial issue. The fund had been capped. What is the status of the health fund, the National Insurance Fund, number one? And number two, what is your report on regularity of payments?
Yeah, one of the reforms His Excellency John Dramani Mahama made in the health sector was to uncap the national health insurance when we took office. And so, for example, in 2024 National Health Insurance Formula, we call their budget formula. An allocation of 6 billion was made to the formula for expenditure. And in 2025, due to the uncapping, we were able to make an allocation of about 9.8, 9.9, almost 10 billion. So more revenue to the National Health Insurance fund. But the most important thing is not even the allocation, because even if the allocation is made and there are no releases, you cannot spend. What it is at the moment is that we had witnessed a scenario or cases where even in some cases a whole year no release was made with respect to that particular year. But this time around, the good news is that there's prompt releases of fund into the National Health Insurance Fund. So now we are paying service providers monthly, every month. In fact, the allowable period of arrears should have been 3 months. But as I speak to you now, we pay them monthly. Any service provider we owe at the moment means that he has not submitted his claims. So there's prompt payment of claims, and that is why you don't hear these issues about service providers wanting to withdraw their services and all that. So the National Health Insurance, as we are managing today, is doing very, very, very well.
I'm going to read a few questions to you. We're going till 10:30 today, so we have a time for some questions from the public. Good evening, Bernard. As Health Minister, what is he doing to put an end to the sale of tramadol and other hard drugs in most parts of the country, since most of our youth are heavily addicted to these drugs? Abdul Mumin Wun Nam in Tamale. Can you address that in a
Yes, we have declared war against the importation of these opioids in our country. So we have increased surveillance on our borders. And what we have said is that apart from the port and the Kotoka International Airport, no medications or medicines should come from any of our borders. Once we find out that any medication is coming from one of our borders, is confiscated and destroyed. And so we have increased surveillance, and we have even confiscated some of them in recent times and destroyed them. So we are much interested in monitoring that space very, very well.
Another comment that came in is from Henry Sogakope. Good evening, Bernard. Please ask the Minister what plans he has for unemployed allied health professionals. Is that what you addressed?
Yes. So we are going to, every budget, I know government is going to give us some quota to recruit, and then we're also looking at how we can export some of them. And all.
So he's asking, can the Minister assure us publicly that all qualified allied health professionals will be posted?
Not all, please. I cannot assure you that all of you. We cannot put 74,000 health professionals on the payroll next year. That's
he didn't ask for next year. He's saying, can the Minister assure us publicly that all qualified allied health professionals will be posted? And when would that happen?
So he's calling for when. So what we are going to do is that gradually, as and when we get the quota from the Minister of Finance, then depending on how much or how many the budget can accommodate, we will spread it equitably. We will give some to the nurses, midwives, pharmacists, allied health, all that.
Honourable Minister, in the resetting manifesto, there's a clear commitment to establish a medical lab council to enhance professional regulation, quality assurance, and the welfare of practitioners in the field. As someone who once served as the ranking member of the health committee and now leads the sector, what is your current position on this initiative? Specifically, how soon can stakeholders expect concrete steps towards making the council a reality to strengthen the standards and professional development in medical lab practice?
A committee has been constituted to look into those matters. In fact, yesterday I even met the leadership of Allied Health.
So, and what timeline are they working with?
Well, they will probably bring me the first report maybe in the next 3 weeks to 1 month.
There's a long one here. I heard the minister talk about the frequency and speed with which equipment break down in hospitals. I think it needs to put together a team of biomedical, mech, and electrical engineers to do a proper assessment and present the data. Much of the trouble may be coming from 1, erratic power surge by ECG system, 2, thunderstorms causing extreme power surges, and 3, inferior control board components. Some of these control board repairs can be done by regular electrical technicians in the communities who repair fans and TVs. That should be done first before suggesting that there's some kind of sabotage going on. We need to treat our healthcare workers with dignity and respect. There's no need being suspicious of them for every little thing that happens. I've operated a scientific laboratory for the past 17 years, and the high number of equipment I use have exhibited frequent breakdowns, but I can confidently rule out any human elements in the situation. So this is a long one. What's your comment?
Bernard, one of the difficulties we have in the health sector has to do with equipment. When we say a health facility is about the personnel, the equipment, that is the diagnostics, and maybe the infrastructure, the edifice, the building. But the last time we did major retooling in this country was around 2014. So when you go to most of our health facilities, we have obsolete equipment in our health facilities. We are doing our best, buying some of them, but Bernard, the truth be told, it's not sustainable for government to continue to buy these medical equipment, and then 3, 4, 5 years later, you have to cough some money to go and replace them. It's not sustainable. Whilst we are looking at buying some of them, what we are thinking about at the moment is what we call hospital equipment placement. We are bringing the private sector in. So listen carefully. This is what we are going to do. Now, what we are proposing, and it's still at the preparation stage, anybody can come and then express an opinion or bring your ideas to fine-tune the policy we are bringing on board. What we are doing is that we will divide the whole country into lots, and then we invite the private sectors that may have some relationship with equipment manufacturers. So when you are giving health facility A, you provide all the equipment at the health facility A. Then the vendor will then train the health professionals how to use the equipment. Okay? When the equipment is faulty or obsolete, it is a responsibility of the vendor to replace or to fix the equipment. It is no more government responsibility. Now, the claims that are submitted to the National Health Insurance has 3 main components. 1, the medication. 2, the consulting or the services. And 3, diagnostics. In this case, the diagnostics will be taken out of the claims to be given to the vendor, so that it will not be government responsibility again to be buying equipment all the time. Once the private sector comes in and they are short of a sustainable way of funding, they will develop interest in safeguarding the equipment, and they will not have this issue of, oh, this equipment is not at this facility and all that. This is what we are proposing, and we are still at the stakeholders consultation level. So this is what we are bringing. And in fact, we have started with the dialysis machines. So we are looking at a similar approach when it comes to the dialysis machines. And Bernard, let me say that as a minister, from where I sit, I hear a lot and I see a lot, especially, reports of incidents. It isn't everything that I can put out there. There are a lot of things that happen, and we are not ruling anything out. It isn't everything I will say on this platform.
There are lots of comments coming for you. I'll take another break. This is the point of view. We're speaking to Kwabena Mintah Akandoh, and it seems like the health professionals have a whole bunch of things to ask you. We'll also speak about Mahama Cares and free dialysis. There's a challenge with H1N1 influenza. We're told that in some schools there's a concern that there could be spread of all of those. We'll be discussing all of this when we come back. This is the point of view live with Kwabena Mintah Akandoh. Don't go away.